Assalamualaikum.
Welcome, Clown. Can you hear me?
Yeah, I can hear you. But you are not visible. आपकी video off है.
Video off है. Okay. Start video. कहीं पे आ रही है?
जी जी. Assalamualaikum sir.
जी, welcome, Clown.
Sir, how are you?
I'm fine.
Alhamdulillah.
And how are you? Left Lahore?
I'm doing great. Alhamdulillah. How is everything going on?
Everything is fine.
So, sir, thank you so much for basically joining, and thank you so much for giving time. Okay, and today the basic topic which I really wanted to discuss was breast cancer awareness, and you are an expert.
Okay.
in that. But before moving on, I would love to have your introduction for my audience first.
Actually, do you think my connection is okay?
Yeah, it's totally fine.
Yeah, so my name is Dr. Ehsan Rehman, and I am consultant oncologist. Currently, I am working at Churchill Hospital, and I have got my own setup, clinic, and I'm providing the cancer prevention services, detection, treatment. Previously, from the last 14-15 years, I was working in NHS in England. So 1.5 years since I am here, so I am establishing my services in Pakistan, especially in Lahore.
Yeah. So I have worked with you, for 2 to 3 days, and
Yes.
For me, that was the best thing, the best awareness I ever had, to be very honest, in
Okay.
easy words. So if we start talking about basically breast cancer awareness, I would love to ask you the first question, that is, what exactly is breast cancer?
What is exactly a breast cancer?
Yeah.
First of all, we should know that we are being in Pakistan, we are a part of like an Asian community or Asia. So we have got the highest incidence, including Pakistan. So 1 in 8 or 8 in 1, you can say nine patient or females are suffering with breast cancer. So it's mean every 8th to 9th woman is suffering with the breast cancer. So incidence is very high. And in Pakistan, we don't have any meticulous database, like a registry of every cancer patient. But still, the available data suggests that we are losing more than 45,000 women every year. And the basic reason is rate. So the breast cancer is a cancer of the breast. It is not mandatory that it will show in breast region. It can show in the neck region, and it can show in the axilla or armpit region initially. But 95%, there are symptoms which started or starts in breast. So the cancer of breast, any change in the breast cancerous is called breast cancer.
Okay, like you just have mentioned, and the most common thing which we usually see is the lump, we call it. There's a certain kind of lump, if it is painful or not.
Yes, yes, it's a lump.
Yeah. So basically, how to identify it that a person has a breast cancer?
First of all, there are certain symptoms which WHO, World Health Organization, told us that if these symptoms are present, you should go to a doctor or physician for a checkup. So what are those symptoms in case of breast cancer? Any change in size and shape, which is different or unusual. Any change in the color, any change in the appearance or the retraction of the nipple, any discharge from the nipple area, which can be like clear discharge, watery discharge, or blood discharge, any feeling of the lump in the breast area, any continuous pain in this region, and any change of the skin, like an orange skin. So these are the symptoms which may be of breast cancer, and one should go immediately for a checkup.
So, sir, what do you think? Why is, I have done my research in this. I have done my thesis in breast cancer. But that was specifically the psychological aspect of that. But when I saw the ratio that you have mentioned as well, the ratio is quite higher. And the mortality rate, Asia stands second on this behalf for the mortality rate due to breast cancer. What do you think? What is the reason behind that?
Well, as far as the risk factors for the breast cancer are concerned, so there are certain risk factors. First of all, it's obviously a disease of a female. It is in the male as well, but they only 1% are very rare. The male breast cancer exists. So female gender increasing age increases the risk of the breast cancer, and early start of menstrual cycle and late stopping of menstrual cycle in the late age. The age at the first child, if the first child is born to a lady who is 30 or above, it increases the risk. Breastfeeding or no breastfeeding increases the risk. The use of hormones like oral contraceptive pills or other hormones increases the risk. The genetic factor is very important, like having a cancer, any kind of cancer or breast cancer in near ones, like in mom, in cousin, in hala, and puppo, can increase the risk of breast cancer. So these are the factors. Other thing is lifestyle. Lifestyle also affect the risk of breast cancer, like smoking, alcohol. Again, the using of pills is a lifestyle thing. Lack of exercise, junk food, high fatty diets that can increase the risk. High fat. Obesity is one of them. Obesity can increase the risk of breast cancer. These are the factors. Now, the mortality which is high in our region is due to the late presentation. The female present late, and the most common factor is either their ideology of thinking that the cancer, the lump is not painful, is most common one. So they don't go to a doctor. And other thing which is we cannot or we are still unable to overcome is their shyness. They think that this might be something which need to be like which we need to hide from, even from our sisters, from our mothers. They don't even tell uh, their sister and mother. So the shyness is the fact. They present late, and so the mortality is high in our region and country.
So yeah, exactly that you have mentioned. So we can say there is the lack of awareness as well.
Yes, the lack of awareness. That we tell them that you have to do this, but we do not tell them how to do it and how to do it exactly and when to do it. So yes, the lack of awareness.
Okay. So if let's suppose a person is aware about it, just the symptoms, who should they reach first for the help?
Well, if they think they have alarming symptom in the breast, so I think they should go to someone who is specialist in dealing with the breast diseases. Now they can go to an oncologist, they can go to a breast surgeon, or they can go to a physician who has experience in treating or dealing with like a big tertiary care hospitals.
Okay. So okay, for through that, the mammography and what exactly could be the procedure for examination, if you can tell.
Well, we recommend that the females 18 or above should examine, like do every month self-examination. That is that they are checking or palpating their own breast, while the best time is when they are in a shower in front of the mirror. So the important thing is, which I have noticed, that they know there is something which is called self-examination, but they don't know how to do it and when to do it. So my experience is they have got no idea that when to do it. So it should be done every month, and the best time to do it 3 to 5 days after finishing their periods of cycle. So this is the best time they can examine. Now, when they want to do it or examine it, it should be like that they are doing something dedicatedly, not like uh, uh, you can say that just to fill in the gap or blanks. Okay, they should think that there is something which is very important, and I am doing it for my own health. So the first thing is they should notice any change, which is like obvious if there is any change, as I told, that change in the color, change in the shape, size, redness, and the orange skin, like skin. So there's something, any discharge in it, there is retraction of the nipple, and then they should palpate it thoroughly, and they should also palpate their axilla armpit area as well. So there are literature, there are pictures, there are videos available on the YouTube. They can see and they can perform. One important thing is, if they are not sure, they should go to a doctor and learn the self-breast examination, because it will be for the whole of their life. So it is one time they will learn to do it exactly how to do it, and then they can do it every month. And then when they will be doing it regularly, then there are the chances they can pick some minor changes as well. But if they are not doing it regularly, like every 3 months, 6 months, or when they just remember, oh, I should just examine myself. So then maybe they will be missing the small changes or small lumps.
Think the self-examination is the first part that a person should know, and for that we being a oncologist or the surgeon, or specifically specialized in breast cancer, you guys can better help the women to make them aware about self-examination. So I think, don't you think more of the workshops, more of the seminars should be organized, where women should come and they should be taught about how to do the self-examination?
Yes. Since I came in Pakistan, and I've been working on the awareness, especially on the breast cancer, because it is like an epidemic, because it is so common. So 26% of all the cancer is breast cancer. Okay, breast cancer. So I regularly arrange the seminars, workshops, lectures, and I try to explain them and demonstrate them that when to do it, how to do it. And I have also started for the students to engage them something like a certificate in breast cancer awareness certificate, and like a breast cancer ambassador. So I have started few programs, the short course like program, and they are free, that they can come and learn, and then they can teach other females. Now, being a single person or few oncologists, we can't teach this self-breast examination to everyone. The idea of teaching to one group is that they will teach the others. So we can cover maximum number of people or the females, that they exactly know how to perform.
That's so true. That's so true. And we would love to have all the details about this as well. Like, the links, something, or the social media links, or any number, so we can share with my audience as well. Most probably, if they are joining online, they can join globally. But if they are, they want to join on site, they can join in most probably Lahore, if I'm not wrong.
Yeah.
That would be amazing, because I feel when I was studying basically breast cancer, I found out that the most of the percentage of breast cancer is due to lack of awareness. So when we we are able to detect it earlier, the chances of mortality can be lower. So it is more appropriate to learn what exactly self-examination is and how to do it. And you guys are doing this thing. Thank you so much, sir, for giving the value to the nation, because that is the most important thing. And as we have mentioned, you just have mentioned that 8 out of 9 women has the breast cancer, most probably. And like, if we see the mortality rate, it's so high. It's so high, and we cannot ignore it. And we are
Yeah,
we
it's one in eight, or it's 1 in 8 or 1 in 9 that every 8 to 9 women is suffering with breast cancer. Yeah.
exactly. So as we have discussed about the symptoms and the self-examination as well, what exactly, there are so many myths around breast cancer. Can you specify some
Yes,
myths around that?
I think better you ask the
Okay.
questions. So what are the myths in the community in the females? Then I can answer your questions.
So I think the first and the major, I just don't know it is myth or not, but most of the time it is said that if you have a lump in the breast or nearby areas, if it's not painful, that is, the sign of cancer, breast cancer. Is
Yeah,
it so?
yeah. So most of them are painless. Okay. So if there is a lump in the breast, it has to be investigated whether there is a pain or not. So it doesn't mean that this lump is painless and this is benign. So the pain is not deciding factor that the lump is malignant or benign. So if there is a lump, we need to investigate it, and whether it is painful or there is no pain. So it needs to be investigated as soon as possible.
Okay. And besides that, I have heard this as well, that um, lying on the odd side of the bed, like on the back side of the in such way that it creates a pressure on the breast. Does it affect as well?
People say that we call it prone position, that sleeping on your chest or back in case of female's breast. So it is not healthy habit, but I can't say there is a direct association of breast cancer with this habit, but I don't think so. This is a healthy habit that you put all the weight on your chest while you are sleeping, and this is uncommon. I haven't seen so many people that they ultimately they sleeping in a prone position, putting all that. There like it is not a very normal or common one, but it is not associated with breast cancer. But one should avoid it.
Okay. And besides that, most of the time it is said that the sunlight really affects us. So, is there any kind of connection between the sun and the breast cancer?
No. There is no, because we are living in a community or in a country where we don't have a habit of sun bath. We know we are not going to the beaches, taking out our shirts and sitting directly in under the sun to have a direct exposure of the sun. And you know that there are uh, areas, countries where the ultraviolet light is different from our region. These are like Australia. So they have got this higher incidence of skin cancer, but it is not directly related to breast cancer, sunlight.
And sir, one more thing is that usually I have seen the role of the partner or the role of the family. So, what do you think is the role of the partner, specifically when it comes to awareness? We most of the time say is that we should aware a woman. Do you think it is important to make a man aware of this thing as well?
Yes, I always promote that the October is breast cancer awareness month, and everywhere there is a pink ribbon. There is a pink ribbon. So I promote that there should be a blue ribbon with the pink ribbon as well to support pink, because I have also started a campaign, pink and blue, I am with you. So this is the slogan. It means that we have to educate our male community to take care of your near and dear loved one, females, whether they are like a wife, mother, sister, puppo, khala, whosoever they are. In terms of that, mostly they are dependent in terms of the medical treatment and decisions.
It's true.
So they not go alone to a doctor. So if they have got any symptom, they should have a full confidence that they will tell their husband and like a brother, sister, anyone, that they will help. They will take her to a doctor.
It's so true.
Most of the time, the barrier is the most females, they are shy to be examined by a male doctor. So we always tell them their doctor has no gender. They are just physician and doctors. So if there is a specialist person, doctor available who is a male, so there should be no hesitation, and also our Deen and Islam allows this as well. A male in a family should encourage the treatment, examination, and also take their females who are above 40 for a screening purpose, screening mammography, which is very important. So the role of male is very important. And even after the diagnosis of the breast cancer, I have seen so many social issues with the female. When the female is diagnosed with the breast cancer, so they have so many social issues. So it has to be addressed, and we need counseling of the male as well, that this is just a disease and it can comes to anyone, not like a female. The male can have any kind of disease or tumor or cancer. So in that case, what a female will do? Should she leave her relation? So mostly not. We should educate males as well in this particular thing.
So you mean educating humanity? To be very honest,
Yeah, humanity. Yes. So I always know whenever I go for a lecture, I said, okay, although you put a pink ribbon on my shirt, but I always support pink and blue concept, especially in Pakistan, because females are not going alone to a doctor for their checkup. They always take their like a mother, sister, father, or like a brother. So even if they are working, they are educated. I have seen in my clinical practice, they are shy and they don't tell about the breast length. They don't go for examination. So they should be encouraged by their male relatives to go to a doctor and to be investigated.
that's true. That's true. So, and what do you think is the there must be so many effects. Like I have studied when I was studying, basically doing thesis on the mental health effect of the breast cancer, and the woman who has breast cancer, what exactly can be the effect of social support, mental toughness. So I just found that mental toughness is so important. Like it is a kind of directly linked with the breast cancer. So a woman who has a good or better level of mental toughness, they can cope up with the situation more in more accurate way. So do you think there could be a certain role of the basic mental health counseling for the woman in this scenario?
Yeah, it is always there. So in the West, in the UK, where I was practicing, once a female patient comes with a lump, so there is a nurse specialist which is like her duty is to be with us right from the start, and she take care of all the other non-medical questions, issues, worries of that lady. So if unfortunately the lady diagnosed with the breast cancer and the lump comes out to be a malignant one, so right from the breaking the bad news, telling her the possibilities, the treatment options, so there is a continuous support of the specialist nurse which is also trained as a psychologist. So they are trained to take care of the psychological issues of the patient as well. So this support I found is very helpful, that the patient thinks that there is someone apart from the doctor that who I can talk to her. I can talk to her on different topics, my worries and questions, because you don't talk to a doctor about everything. But sometimes you need a person that I should express my worries and ask questions. So the specialist nurse role is very important. Who are trained in psychologists as well, and they right from the start, they were there until the end of their treatment or even the follow-up. So they are like a friends there. So we don't have that system. The concept of specialist nurse is not here in Pakistan, but hopefully in the future we are trying to have such a system that there are certain specialist nurses for the type of a cancer.
Exactly. You know, there's a already a physical pain due to the breast cancer. I think that creates some emotional pain that should be regulated and should be catered out. And I think
Yes.
this should be in every major physical pain that should be connected with the mental health specialist as well, because they can more better cater out the emotional pain. Do you
Yeah.
believe?
Yes, you're right.
Yeah, so exactly, there was another point in, because I'm discussing my research on it, and like adding some more point, I saw that the social support from most of the time the closed ones. Okay, when a woman has a breast cancer, the social support of nearby people is required, but is not helping them. Okay, rather than that, when it comes to the mental health professional, they are really helping them to regulate their emotional pain. The point that you just have mentioned, that they need someone to speak to, and they they prefer the person who can understand them in a better way, rather than just talking to the ones who are from the family members, obviously, but can't understand her her actual problems.
Yes.
Yeah. So this was another point in this as well. So we have discussed some the symptoms as well, the how to diagnose it basically, and okay, there's one another question: how many stages of breast cancer actually we have?
There are four stages. Stage one and two, we call it early breast cancer. Stage three is advanced, locally advanced breast cancer. And stage four, we call it metastatic, or the cancer which has spread to the other organs. So there are four stages of breast cancer.
So, and when we talk about the treatment side of the breast cancer, what exactly is the initial treatment when identified?
Well, it is very important that when the decision of the treatment is taken, it should be taken by a team. Like the team means that there should be an oncologist, there should be a breast surgeons, and there should be a radiologist. Then when we establish that this is a breast cancer, then we assign a stage to the cancer, like stage 1, 2, 3, 4. Now for early stage breast cancer, stage 1 and 2, it is said generally that the first step is the surgery. Surgery is the best treatment. And it should be performed by a trained surgeon who knows how much to take out, and what are the steps and what are the recommendation of the surgery. Stage three, the breast lump is a big size, so we sometimes we need to reduce it by the chemotherapy, and then we can perform surgery. Stage four, when it has spread, then we can always just support them, give them some palliative treatment. Palliative treatment can be chemotherapy, radiotherapy, or hormone therapy. So the treatments which are used in breast cancer, I will just summarize it. Those treatment. The treatment number one is the surgery, then chemotherapy, radiotherapy, hormone therapy, and some target therapy. So all those available options are used according to the stage of the patient, and it is the individualized decision depending on the age and other factors, other medical factors as well. So if the patient is not fit for the surgery, so obviously we can take the lump out, we can do the surgery, but the patient is not fit for anesthesia for surgery, so we can't do surgery. So other medical condition also does matter in the decision making. So in Pakistan, we are seeing mostly the young patients who are 50 or less than 50. So this is another thing which is very in our community. We are seeing more young patient and more patient advanced cases rather than the rest.
Yeah, that's so true because when I was observing when I was collecting the data, I see that the majority of the women were round about 40, like
Yes.
nearby 40 or above 40. And the
Yes.
only reason was not detecting it early. So late detection caused it. Basically, there could be many other reasons, but the major one was a late detection as well. So yeah, this is another reason in that as well. And if we are talking about the treatment, and we have talked about the types as well. So what specific message at the end you want to give to the people regarding breast cancer?
Well, I will say the first thing is the awareness is the best. If we create awareness and we create a task force, the task force which has gone through a little bit of training, as we discussed, like a self-based examination, how to do it, when to do it, and also I have established a breast cancer helpline that the ladies can call and can ask questions and can have guidance. All those questions which we have discussed today, they can ask on a telephone. It is a free service. The basic thing is awareness. I always said that the breast cancer is curable and the breast cancer is treatable. The only catch is if it is detected in early stage, we can save life and the lady can live a normal life. Not only we can save life, but we can also save breast as well. So we don't have to do a major operation and remove the part and whole part of the breast tissue if it is detected early. So it is very important that they understand the value of early detection. So the tissue is preserved, saved, and the life is saved if it is detected early. And the ladies and the many females are living a normal life after a breast cancer if it is detected early.
Exactly. Thank you so much, sir, for giving such an amazing time and sharing such a valuable information with the people. And it definitely is going to add values in the life of so many women or men, anyone around, whoever listened to this session, inshallah. So thank you so much, sir, for giving us an amazing time.
Yeah, thank you very much, Usman. Thank you very much.
Thank you so much. Allah Hafiz.
Okay. Allah Hafiz.